A very warm greetings. Welcome to another exciting edition of PT for 199 presents Student to Resident Nursing Edition. Thank you so much for joining us today. And in this series of conversations and talks, we are actually discussing various issues and professions which will lead a student to a permanent residency pathway in Australia. To discuss today's edition, we have two elite guests with me, Mr. Kamaljeet Singh, who is a registered MARA agent at OSIS Group, Clayton branch, and we have Rajinder Singh with me, who is the founder and registered education consultant at The Migrators. Welcome, gentlemen, to this show again.
Thank you, Manu. Good afternoon.
Thanks, Manu.
Good afternoon, guys. How is the weather in Melbourne, first of all, to start with?
The weather is pretty nice. I think it's a little bit windy and
raining as well.
Yeah, raining as well, but we still got, cases going on less than as comparatively where Manu is sitting right now.
Victoria, I think, yeah. So we can't compare Sydney to Melbourne for sure, because I think Victoria has registered about 500 cases today, but NSW is still struggling to get down the cases to even 1,000. So I think we are far ahead of Victoria at the moment.
As long as I think, Manu, if people are getting serious about getting vaccinated,
absolutely.
And I think out of us three, Rajinder is only one who has, sort of 100% into vaccination.
Yeah, I will get the second jab end of this month.
So, yeah.
Maybe I get some freedom.
Yeah, of course, we can expect that. And I'm looking forward to the freedom as well. So guys, just to start with, if you have any questions regarding your PR pathway in nursing profession, and if you are a nursing professional in Australia, this is definitely the session for you. So feel free to jump in and ask your questions. We have an elite panel of experts today with us, and who will guide you towards the right path in Australia. Okay, to start with, the first thing first, Rajinder, what is nursing and why should I choose nursing?
All right. That's actually interesting topic due to like all the current situation. We cannot talking about pandemic. So all the I can say health sector in high demand as per like a migration guideline. We cannot discuss with the Kamaljeet how it's a high demand. So if we talk about nursing, if we check previously invitation round or in any state, nursing always in a demand. So if you have a registration in your nursing, like you've done Bachelor of Nursing or Master of Nursing, and you get your skill assessment through like the authority, your PR pathway is easier than other occupation. And it's expensive course, but still it's much better than other occupation if students or whoever coming from overseas, they are eligible for that course, then it is the better pathway to other courses, because you have to get your skill assessment with all the requirement, and it's easy to leading to your PR pathway. And about the PR pathway, Mr. Kamaljeet Singh will explain us like how it will be possible for all the students.
Kamal sir, is it right to say that nursing occupation has a dominance in permanent residency pathway in Australia? Is it correct to say that?
See, Manu, sort of, people, I believe, in fact, that are getting jealous when it comes to nursing candidates. Okay, now we should, first of all, thank all the nurses and other frontline workers who have basically in this pandemic, helped and sort of try to recover us out from that kind of deadly disease.
Absolutely.
But again, yes, when we are comparing things in regards to dominating, not only nursing, many other fields like engineering, when it comes to a sort of infrastructure, and patients have also been dominant equally. But given preference to the nursing course, I would say yes, looking at current situation all over the world. Not only nurses, we have seen microbiologists, pharmacy technicians. So most of the medical sort of occupations, we have seen that have been given the preference. And using the dominant sort of word would not be sort of what the candidate would be expecting. Thankful can be a better word, especially if a candidate has been working as a registered nurse and he or she has given her 100%, because in Melbourne, we have seen, there are nurses, Manu, who especially, the guys who have been working like 80 plus hours, and
Wow.
they don't want to, but still, because, they are on that kind of a line that their services are much required. So in regards to when it comes to nursing profession for PR, I think that would be the best priority for candidates. Yes, but again, nursing occupation involves a lot of, sort of mental trauma as well. So especially nurses who are working in critical care, we have seen nurses working in aged care. So if you are that type of candidate, Manu, who is basically not scared of all those loud shoutings on when it comes to seeing blood, we have seen candidates start fainting, So yes, nurses can be sort of given the priority, and we should be thankful that, they have been one of those medical profession candidates who have stopped, or at least tried their, 100% to stop this kind of this COVID pandemic.
I can't agree more. I completely agree with you, Kamal sir. To start with the student, because we are here to discuss the entire journey from being a student, a nursing student, to the permanent resident of Australia. To start with, what is the duration of the nursing course, Rajinder?
Okay, Manu, first of all, I just explain how many courses will be leading to registered nurse or other occupation. So we can divide these courses in a 3 division. So first one is a diploma of nursing, second bachelor of nursing, and masters of nursing. With the diploma of nursing, you can leading to get your occupation as a enrolled nurse. After that, bachelor or master, if you've done it, finish your study and get your skill assessment as a RN, so it will be leading to registered nurse. So in both, most probably, if as we can discuss with Kamalji, I think registered nurse is more demanding instead of like enrolled nurse. But still, enrolled nurse is a way pathway to, if you get your invitation or if you're successful to get your any pathway to leading to PR, that's great. But again, if you still struggling, then you have another pathway. You can leading to bachelor of nursing. Okay. So they have a little bit different requirement, but almost they have a same requirement as English requirement or other things.
Okay. And Rajinder, when is the next intake?
Again, they have a 3 courses. They have a 3 different intakes. If we talk about diploma, they have a more durations in every year. Like you can get in Feb, April, August, or it's depend on the colleges as well, because most of colleges run this diploma of nursing courses. So you can go with the Feb, April, August, again June as well. If we talk about the bachelor, they have a almost most of the universities just a 2 intake, Feb or September for 2022. Again, in masters, again it's a Feb and July.
Feb and July. Okay. Relevant question to you, Kamal sir. How is enrolled nurse different from a registered nurse, and is there an extra advantage, being a registered nurse?
See, Manu, when we are, comparing those sort of occupations, we do understand they are basically relying or lying in same sort of industry, but there's a way long, difference in comparing the occupation, basically the duties. Registered nurse, it's more responsible and has to be more sort of caring in regards to managing, basically the structure or whether the venue where he or she has been working. Enrolled nurse is basically more focused on one sort of particular job or given number of clients. in regards to particular on a set sort of scale. So that's why when we are sort of, if we are comparing these occupations, you can say, Manu, basically registered nurse is more responsible, and it's more sort of, you can say that qualification difference as well, because in regards to enrolled nurse, you can only study diploma of nursing, which as Rajinder has already mentioned, and they do have regular intakes, okay, and it's easier sort of pathway, to candidate to get into the nursing sort of sector. But on the other hand, when it comes to registered nurse, minimum bachelor's is required. Even if you're an offshore candidate or you are an onshore candidate, minimum bachelor's is required. So the more the qualification, you get more high pay and you get more responsibilities. So in that way, registered nurse is basically, sort of different to enrolled nurse, and more responsible and more sort of in demand when it comes to PR pathway as well.
So comparing the two different occupations, enrolled nurse and registered nurse, I think what you're saying is the registered nurse are given preference when we're talking about permanent residency, isn't it?
See, Manu, when it comes to, as in the start of the show, Rajinder mentioned that the nursing course is pretty expensive. So when we are focusing on nursing courses, he's basically trying to explain bachelor's and master's. Okay. So given that kind of luxury, that okay, it is expensive, but again, PR pathway is there. Enrolled nurse is not that kind of expensive when it's compared to a bachelor's or master's. So again, you have to weigh up your things, that okay, I'm going to be investing that kind of money in bachelor's or maybe your master's. Maybe is that your piece of a cake? Some people might not even like nursing. They might have started or invested that kind of money into the course, and given that after 6 months, because 100% attendance is required when it comes to nursing courses, because if you are sort of missing classes, Manu, and then again, what kind of things you are learning, the code is basically not in your head. You don't know how to basically practically work in there. So there is a difference. It's basically, when we are again comparing the difference, there would be other candidates as well, like we call them PCA, personal care assistants, who are basically working in aged cares. Again, same sort of industry, looking after people, but different occupation. So given that kind of, it's always way up. You can spend big money and do bachelor's or master's and make a pathway to PR. Or if you believe nursing is not your piece of cake, just maybe go into diploma first. Have a thought about it. How does it sound? And then onwards, you see if you want to further do bachelor's or not, because it's going to be taking a lot of money out of you.
Okay. Rajinder, what is the structure of the nursing course?
Okay, first, I just discussed before we going with the structure, the basic requirement to enroll in the course for different courses. So diploma of, 3 of them, we need a 7 in each in English. So that's the first requirement. And you have to get your children check to enroll in that kind of courses. And it's depend on if you have a previously relevant study, then it's easy to enroll in all courses like a master's, bachelor, or diploma. If you haven't any relevant study previously, then you have to choose kind of the pathway, which one leading to that degree. So for example, diploma, you can go with like a certificate 3 with the individual sport and go to diploma, but you can straightway go with the diploma of nursing as well. So if we talk about the bachelor, you have a previously relevant study like medical background, like year 12 in a medical, and it's if we go with the masters of nursing, then you should have relevant study with the math and bio. Right. So it will be helpful to enroll in a masters of nursing. And if still you haven't those things, then you need to enroll in at least a 4 to 6 week the short course, which one cover up that things and then you can eligible for to enrolling in a Master of Nursing.
Okay. Okay. What are the English requirements of?
Okay. So the English requirement for all three courses is at least 7 in each.
Okay. 7 in each.
Yeah.
For the admission, correct?
Yes, for admission. I think as well with the skill assessment as well. If we are not wrong, like we can ask Kamaljeet regarding that skill assessment. I definitely like it's a 7 in each. Then you can go through with the skill assessment as well.
Okay. And is it the same for the Bachelor of Nursing? The eligibility criteria would be the same?
Yes. Yes. Okay. So again, if you done a medical background, like year 12 in medical, so definitely you have a medical background. You can go with the Bachelor of Nursing, but mathematics is a mandatory because you have to calculation everything with this course, kind of course.
Okay. I have a question for both of you actually. And this is in regards to the nurses who are working in India and wants to migrate to Australia in future. Yeah. So what is the correct and ideal pathway for them?
All right.
So come and study here, or is there a different or separate program for the people who are already into nursing?
Okay. If we talk about overseas student, most of the student, if they done year 12 in medical, they can come in a bachelor. It's easy, like they don't need to any hurdle or anything. So they need to provide their minimum requirement, 7 in each, and straightway get the good university admission like Victoria, Deakin, Torrance, etc. Okay. But if already someone done further from year 12, like a bachelor or some kind of nursing other courses, then they have a kind of program. It's called ION program. Previously, it will go through, but after like I think last year they closed it, and that we can further discuss with Kamaljeet like how it worked. I give you roughly idea, like they got like kind of invitation from the authority, and they get their assessment, everything, and then they can come here like on a tourist visa, and they finish like a certain part of study, so they can get their skill assessment according to Australian standard nurse. So I think further we can get with the Kamaljeet, and he can explain like how it will be happen.
Kamal sir, over to you.
See Manu, first of all, when we are talking about any kind of a profession which is basically talking about people's life, you have to study codes. In nursing there are codes, in lawyer firms there are codes, even in police or any kind of firms dealing into services will have codes. So if a candidate has studied, for example, bachelor's of nursing back home and is looking for further pathway for straight PR, there is no possibility, because the codes of Australian nursing has not been satisfied by the candidate. So basically he or she will apply for a skill assessment. Okay. And skill assessment once get refused, you are given a referral letter from AFRA, and then you can further take admission into your bridging program, which was basically named ION program. They have now we have seen that one of the university, I think is University of Notre Dame, one in New South Wales and one in Western Australia, has started this program until December 2022 due to this COVID. And again, candidate has to be in Australia, because practically, you have to attend the classes and you have to go from there. It might be online as well, but again, we have to double check that kind of scenario. So candidate has finished bachelor's from overseas, they need to enroll into this bridging program, or they have to do an exam, which is also again done by the registration authority. And once you clear the exams, theoretical and practical exam, then you get a registration as a registered nurse. Correct. And then basically you can work in Australia as a registered nurse. Again, there is exemptions for certain nurses who have been working from, for example, New Zealand and Canada and those kind of states. Sorry, those kind of countries will be getting exemption, but practically we are talking about candidates who are from India. So if you have done bachelor's from India, you need to do a bridging program, or you have to do an examination. Correct. Once you've done the examination, you'll get the registration to work as a registered nurse. And then further you apply for the skill assessment pathway. Again, as for registration, 7 each is required. Okay, you can, the good thing about nursing is PTE can be included, not like other occupations like social work or teaching, where IELTS is mandatory. In last couple of sessions we have already discussed about that. So yeah, nursing is both of sort of reliable and flexible in regards to PTE can be used that. And then further on, once you get the registration, you do your skill assessment done. And then further, if candidate is planning to come to Australia, as Rajendra has mentioned, on a visitor visa, do take your options. Which state would be better for you, even if you are planning to do a bridging program, or for example, if you're doing into masters into nursing, because some people can choose masters of nursing as well when it comes to practice and get the registration. But you have to choose your states wisely accordingly. Where should I go and complete my studies, and then further look for PR pathway.
Okay. Now I would like to take a question from one of our viewers, Nidhi Patwari. She wants to ask that what is the enrollment criteria for citizen student? So who is an Australian student at the moment, and she wants to take admission in nursing. What is the criteria?
Okay, first of all, Nidhi Patwari, thanks for joining the session. And she has said, hello, Manu. Hello, sir. What are the enrollment criteria for citizen student? Basically, Nidhi, how things work in regards to study is, Rajendra is more expertise in international sort of, getting the enrollments done. But same scenario goes with the international student. But they will be a sort of, if you are an Australian citizen, you will be getting a sort of, we call that HEXA help, basically government sort of will helping you in regards to the enrollment. So you can either directly contact the sort of universities, whether you want to go with Victoria, Monash or Swinburne, what kind of university you want to go with, you can directly contact them. If you are not too sure, you can contact Rajendra. He can guide you through. He can also help you with the admission, but with the admission process, eligibility is same. It's just a matter whether the fee structure will change, because for international student you have to pay the fees. For citizen students, basically you get the sort of a loan from the government, and then slowly you can keep on paying that. So this is the basically a process, Nidhi, that you can follow when you are focusing on getting admission if you are an Australian citizen.
Thank you. Thank you so much, Nidhi, for asking this question. If you have any more questions, feel free to ask. Moving on, I've recently, read about a graduate certificate in nursing. So first of all, please enlighten us, what is graduate certificate in nursing, and what are the relevant PR pathway moving forward?
Okay. See, Manu, basically, we have seen candidates who have studied nursing. They can show their background. If they are able to secure 1 year of study in that kind of, we call it study specialized in nursing, only certain universities will be helping you get that admission, which is normally, done after bachelor's. And some of our candidates would be doing it after master's. So you have to complete the studies. It is basically relying on that your assessing college, your studying college is accredited by the assessing authority. Once you complete that studies, you fulfill the other requirements and you get the registration. And then the process basically stays same for the nursing. You have to obtain 7 each, get your registration, because your background was in nursing. For example, you've done the the graduate diploma or graduate certificate, or you've done masters in nursing or something like that. You meet the mandatory requirement, get your registration, apply for the skill assessment, and then you go from there.
Perfect. Rajendra, I have a very important question. Which states are best for a nursing study? And I have a parallel question to Mr. Kamaljit sir, that which states are best to complete the studies so that it can lead to the permanent residency?
If you thinking about the masters, so you can done master. Okay, the registration. If we talk about the RN, you can done anywhere. So it's the same. I think rule or regulation for those RN. Maybe little bit slightly different in a point system. So Kamaljit will be explain to us like Victoria is a better, or New South Wales. I think all are same for RN. But if we talk about the diploma, Ian, so I believe South Australia, it will be a better for those students who just are planning for enrollers. So again, Kamaljit will be guide us like what state is much better than PR pathway for enrollers or RN.
Okay, yes, thanks, Rajinder. Manu, when we are focusing on, registered nurses, some candidates might take it to granted that, okay, even if I'm studying nursing, it's going to lead straight to PR. If you're in Victoria, I'll doubt it, because if you have recently finished your studies in nursing, Victoria is preferring people who have studied their nursing, plus who have been working as a registered nurse for at least, some sort of duration. Now, there is no such duration, but again, let's go it very simple, Manu. If someone has completed nursing, for example, bachelor's, they are basically getting their skill assessment done as a registered nurse. NEC. NEC means not elsewhere classified. So there is no such classification if you've done your bachelor's. But if, say, for example, a nurse is working in sort of aged care, or nurse has been working in critical care or mental health for at least 3 months, you might be able to obtain your skill assessment in that particular specification or specialization. So you will be getting your skill assessment done, for example, as registered nurse, aged care, or registered nurse, what do you call it? Aged care, mental health, or critical care. But again, Victoria is preferring candidates who are working either as a midwife, peri-operative, aged care. We have seen a lot of candidates. So if you are that kind of student, who's already working in aged care and studying nursing, I'll probably suggest Victoria might be a better option. Okay. When it comes to registered nurse outside Victoria, most of the states are pretty good. Leaving Queensland, they haven't given us any updates yet. I personally prefer that state, to leave out of the window when we are sort of investing at least 3 years in bachelor's or 2 years in master's. Apart from Melbourne, we should maybe think about South Australia or Western Australia would be a better option. There would be a lot of candidates who have completed diploma of enrolled nurse or who are looking forward. South Australia can be a good option as well, but they will require you to work alongside you are studying your diploma of nursing. Even as a PCA should be fine. But if you are not able to find work during your studies, you better start looking for work after your studies. So South Australia will require you to work. My personal preference in regards to diploma of enrolled nurse would be New South Wales regional at the moment, because New South Wales is giving a lot of invites. Sad news about Western Australia in regards to enrolled nurses, they do not invite enrolled nurse. So Western Australia is out of the window. I would say, if not South Australia, New South Wales regional, if we can find any sort of universities, the candidates can contact the counselor, and then forward, there are possibilities for 491, or even if you are able to secure high points, and you might be selected for 190 as well for New South Wales.
Great.
Yes.
Looking at
Manu, again, I just mentioned one more thing here. Those students who just considering to enroll in a Bachelor of Nursing and Masters of Nursing, they are not already applied their TR, or they already use their TR. So they can migrate to any regional area, so they can get extra point and you can say extra TR extension. But again, in Diploma of Nursing, you can't apply for TR. So again, as Kamalji said, you can go with the New South Wales. It will be a best option.
Wonderful. Kamal sir, looking at the previous few rounds of invitation in nursing, what would be your advice for the people who are currently studying nursing in Victoria?
See, Victoria has always given preference to candidates who are in nursing. Okay, no doubt, they have always seen candidates with high points. If you are studying in Victoria, I'll probably suggest, Manu, that you start looking for job as well. There is no basically sense that you complete any kind of qualification and you are not able to find a job in that particular stream if you are looking for Victoria to nominate you further. So if you are studying a sort of bachelor's in nursing, I'll probably suggest you to start working, at least in aged care or somewhere where there are possibilities for you to secure a job. If you are finding it hard that, registration is must when you are working, in sort of places like hospitals or something, finish your course, especially if you're doing bachelor's, apply your TR. If your agent is smart enough, he will be able to drag your TR for at least 1 year. In that 1 year, we are hoping, that we will be able to find a job in
Right.
Victoria. If we are not able to find a job in 1 year, Victoria, Manu, then I would probably suggest that nurse, maybe she or he is not serious about his or her profession. So again, job is must if you are in Victoria.
Correct. Okay.
Manu, I'm just interrupting you. I just got a question for Mr. Kamaljeet. If we can talk about registered nurse, overall, which points they are standing for invitation all over Australia or every different states? So
See,
it will be much helpful those all candidate who already applying for their invitation round, or they thinking about like they're going to apply for which state they can more preferable like they get the invitation.
See, Rajinder, when it comes to nursing profession, points are not that sort of much focused sort of thing. They are basically relying on sort of requirements of the state. So we believe that if candidates in Western Australia, okay, or if candidates in Victoria, if candidates in South Australia, they've already fulfilled that kind of requirement of studying in that particular state. Okay. So apart from Victoria, most of the states are pretty lenient when they are, inviting candidates. Say even like Victoria, 70-75 points would be pretty good for nurses. Western Australia, if you've studied there, you have been working there, you are straight, good to go with the nomination process. Now, if there is some nurse who is in Victoria, is not able to find a job in Victoria, wants to go to Western Australia, again, we have been mentioning from last 2 sessions, Western Australia has been very sort of active in regards to inviting candidates. They have always, invited candidates on the basis of job offer. So if you are able to secure a job offer, you might be eligible for Western Australia as well. Then comes South Australia. If you've studied there, sort of work experience you've done, there are high possibilities you might get waiver as well, depending upon how much percentage we have scored if we have done bachelor's, masters. So different sort of states will have different kind of points. But when it comes to, nursing kind of occupation, Rajinder, it's not much high points. As long as we have met the minimum requirement of the state, there are chances that the candidates would be getting the invites.
So in that, I have another question. So all the nurses, registered nurses, which criteria they met more, like for 491 or 190 or 189, if we can say?
Yes. So with the 189, the point system has to be 85 to 90 points. Okay. With 190, the points have to be minimum 65 points. With 491, the points have to be minimum, 50 points individual, and state gives you 15. And then with 190, state gives you 5. So that is the minimum requirement. Depending upon that, we have to see how much a particular candidate is making on, how many points they are making on. And then accordingly, we can advise them whether we should go with 190 or 491. But according to the state are giving them 190 because it's sort of that occupation, which is a frontline occupation, supporting critical sector, much needed sort of occupation. They are targeting straight 190 if a candidate can show a job.
Perfect.
And another thing, we talk about offer letter for Western Australia. So the offer letter, they have to show like a kind of 1 year contract or something with their employer, or you can just get the invitation for your employer, like they invite you for in future you can work.
Okay, so how basically Western Australia work is they will ask you to lodge an EUI. Once you have lodged the EUI on high points, okay, they will be selecting you. It's not only about nurses, it's all other occupations as well. So they will be selecting your EUI if they believe, your EUI makes sense and there are high points. and there is a need of that particular occupation in the state. So once they have selected your EUI, you are given 14 days, Rajendra, okay, to lodge Western Australia state nomination application. Within those 14 days, you have to get that job offer letter. Okay, if you have already got a job offer letter and you are already shifted to Western Australia and you are working in your nominated occupation, have you been invited already? There are high chances, because candidate has already moved there. Now, question rises how long the job offer should be. Minimum 12 months. Okay, when you have been selected to apply for the state nomination, you must have at least 12 months of employment sort of, commitments in Western Australia for next 12 months.
All right, thank you.
I have a question regarding AFRA registration. Now, what are the documents required for AFRA registration, and what are some eligibility criteria?
All right, Manu, when it comes to AFRA registration, okay, most of the universities, if you have studied from Australia, basically the universities will guide you through the registration process. If let's talk about if a candidate has not studied in Australia, okay, major documentation is the candidate has done minimum bachelor's in India, okay, especially if we are talking about Punjab or some other states. We have seen there are two occupations called GNM and ANM. So basically they are pretty similar with like enrolled nurse and registered nurse. So if a candidate is GNM, has basically done bachelor's of nursing. So if you have done bachelor's of nursing from India, okay, you will have a registration done in your nominated. There is no such nominated occupation, but yeah. So in your occupation, you will have your registration. So basically you can work as a nurse. Yes. I will be requiring that registration. I will be requiring your police checks. There is a certain type of police checks done for nurses, okay, especially overseas when we have overseas nursing trying to come here. For the documentation like PTE is required, or English IELTS, you must have 7 in each. Then moving forward, all the documents, your identity documents must be verified and all those kind of things. You apply for the AFRA, and then AFRA, if wants you to, any other further documents you require from your side, especially with the police checks. When we have seen character checks given from the registration authority, takes sometimes a little bit of time. But yeah, there are a series of documents. It would practically would not be possible for us to explain each and every single document on this video. But yeah, there are a series of documents, basically identity, qualification, registration, and your police checks would be able to satisfy AFRA registration alongside with your English score.
Kamaljeet, I have just a question regarding that skill assessment. So if we talk about overall India, or just a specific, just pick one state, for example, Punjab, the skill assessment has any requirement like they only take the student who finished their study in a specific university or college, or it's it's open for everyone, like whatever they've done in their home country, and they can accept every student and they can go through their application?
All right. See, Rajendra, when it comes to nursing, basically the college, if it is not that kind of a level college, you will not be able to obtain a registration from India as well. So if you are, considering from, say, for example, from Punjab, we have got their registration authority in Mohali. Okay, so Mohali itself, the registration authority itself will basically not give you a license, we can say, to work there as a registered nurse. So if you are able to provide us with a registration, basically a license or a registration to work as a nurse, then we are all good to go. We are sure, okay, this college is good, there should be no issue. But if the girl is saying, okay, I've done bachelor's, but I do not have a registration. Okay, so for example, I've nearly done my bachelor's, but I do not have a registration. There would be a placements for a candidates who are doing bachelor's of nursing in India. They normally do placement, same like Australia in their last semesters, and after that, that placement is used to basically satisfy the requirements of registration, and then you get the registration. So in that guide, I'll probably advise the candidate to get the registration, and then further we apply for AFRA. AFRA gives the refusal, you do the bridging program, and that's it.
So basically, all those students who got their home country registration, they can eligible for apply skill assessment for Australia. And again, you just mentioned all the pathway, then they need to follow.
They will be they have to satisfy the before skill assessment. We have to get the registration from Australia as well.
All right.
So for that, we have to get the registration. For that, they might have to go the exams, or they might have to go with the bridging program, okay, iron program basically. And then once you achieve that, then you are moving forward.
Okay, I have a very interesting question, which is asked by one of my students, Simmer, on WhatsApp. And she's asking, university in Melbourne for Master of Nursing and criteria for those universities, especially Monash, they have a short course criteria for non-nursing background also. What about that? And are they conducting online tests these days?
All right. For this kind of enrollment for like they haven't any relevant study previously. So again, the bachelor or master must have a relevancy. So that if she just mentioning that course is, I think, 4 to 6 week course. So what they do, they just go through all the subjects, which one they're going to help to in a master of nursing. It's, for example, they want to teach them mathematics, biology, and another subjects, so they can fulfill their minimum requirement, so they can enroll in a master's course. So again, even after you done that course, it's depend on a university, because in Melbourne they have only 2 universities, Melbourne University and Monash University. They're gonna check you, go through with your application. Even if 10 people done this same thing, but they're gonna priority other student who has a more strong file than that kind of student. Right. So that possible, they can go with that, and they can apply for their admission in Monash and Melbourne. But again, the chances of admission depend on a university. If they accepting like we haven't, okay, again, it's a bit, if they have a seats available and they not get any highly recommend student, like which one more suitable for these kind of student, then they can easily get the admission. So again, it's a depend on a university.
Are they conducting any kind of online testing these days?
It's the same thing. So they need to enroll in a same like a college or university, finish that. Maybe due to what we say, pandemic, it's starting online, but they need to attend physically as well, because they're gonna show them a practical or something like that.
Okay, thank you, Rajinder. I hope that answers your question, Simar. Kamal sir, I have a very important question to you. What are the biggest mistakes? And tell me, from your experience, what are the biggest mistake a nursing professional, do while registering the interest with the immigration department for residency?
Manu, before we go into this question, I want to listen to that previous question again.
The previous question.
One I think Rajinder has already answered.
Simar.
Yes.
Okay. So university in Melbourne for Masters of Nursing and criteria for those universities, especially Monash. And she's saying that they have a short course criteria for non-nursing backgrounds also. What about that? And are they conducting online tests these days?
All right. So as Rajinder has, mentioned a lot of things, maybe I'll try to explain a little bit step by step as well. What she's asking is basically, say, for example, if she has done MBA, okay, and she wants to get enrolled into Masters of Nursing practice, okay, which is the name of the course. So eligibility criteria is, first of all, as Rajinder mentioned, you do not have a background in nursing. So for that, you have to do an exam, okay, which must be major either in mathematics or biology, as Rajinder mentioned. So that exam, which she is saying can be conducted online, it is depending upon the university. There are high chances they will be, able to help you get this exam online. But as Rajinder mentioned, for the studies, again, it would be questionable if, they will be giving us an online sort of luxury to study, because it's not a management course, it's a nursing course. And once you've done, that kind of course, it requires a practical sort of, what do you call that, exposure alongside. For that small course, which is basically trying to satisfy the criteria of the study, I would probably say can be done online. which again, educational counselor, Rajendra can guide you through there, or you can contact Aussie's group. The candidates will, guide you through there. But for the nursing itself, you have to practically visit and complete your studies.
Right.
Then
Okay.
Because in that they mentioned like a mathematics, it's depend like a when we just inject someone like any drugs, so it will be accuracy. So that's accuracy will be, if you done like a little bit higher, then they got a trouble, or if it's little bit lower, then you're gonna get the trouble. So it will be perfectly like a practical work. So they're gonna teach them like a mathematics most of the time, like how you use that drugs and quantity, everything. So I say like it will be majorly you need to attend in the college, but if they have a no choice, maybe it's online, but most probably they need to learn there 4 or 6 weeks, so they can satisfy their criteria for admission.
Purely selection is based upon your skills, correct?
So sorry, what was that?
Purely the selection is based upon your skills.
Yes, again, it's depend on a university. Okay, in master's course, it's depend on their profiles, because you have a non-relevant study previously, so you are going to done the masters. It's 2 year. It's again like a bachelor or master. It's the same, but it's a 2 year, and that's 3 years. So you can easily get your registration after that. You can choose your pathway. So they will choose very carefully. So they're choosing like a right candidate for their schools. If they are full, it will be a straight away no, like, and they have like a 3 to 4 month processing time. Again, it's in Melbourne, just a 2 university, Monash and Melbourne. So again, only totally depend on university, they agree with you or not. Yeah.
Fair enough. Okay, well, sir, coming back to the previous question I had, what are the biggest mistakes a candidate has to avoid making in the process of taking residency in Australia? And please tell me from your experience, what are the mistakes which actually happened in some of the files or cases, and mixed with your personal advice to the candidates who are currently pursuing residency in Australia in nursing profession.
Manu, when we are talking about permanent residence pathway, okay, it's always advisable that let the professional candidate, sort of professional agent do your job, on the basis. We have seen candidates lodging wrong EOIs. Okay, we have seen candidates giving incorrect information to the department, willingly or unwillingly. We have seen candidates using a sort of dodgy work experience to get extra points or obtain sort of extra points to again get the invites in EOI. We have seen candidates not basically responding to requests when it comes to visa requests. We have also seen candidates, giving false sort of or bogus sort of documents to their registered migration agents, or the candidate who is doing their visa. We have also seen there is no trust, when it comes to lodging your visa application. Manu, is not a joke. Is when especially coming into a PR pathway. PR pathway does not start when you finish your course. PR pathway starts when you land here in Australia. So if a candidate, is serious about getting permanent residency in Australia, he or she must be fully aware of his or her sort of scenario, her situation. Unless, yes, there are a lot of candidates who would not require to settle down in Australia. They have a main motive to finish their studies and go back and work, yes, in their sort of occupation, or maybe open up their restaurant. But most of us, we have seen once they come here, Manu, on a student subclass 500 sort of visa or any temporary visa, they sort of like this country and then they want to remain here. We have always advised candidates that if you are looking further for permanent residency or any kind of education or migration advices, don't listen to your friends. Okay, you should always basically try to understand the situation, try to explain your scenario to your Mara agent or your educational counselor, depending upon if you are choosing any that kind of a course. So again, the biggest mistake would be if you are too late. The reason is you yourself. that you have, created that kind of a time period. Say, for example, we have seen candidates, Manu, they will, especially, IT candidates, I should say, they complete their professional year, they haven't done ATEACH, they haven't done CCL examination. So basically, we are nowhere. Yes. And then how we gonna, sort of judge the profile, and then the candidates start investing time and money into English examination alongside CCL examination, which will require another 6 months. And you have seen that in past also, states within 1 month, 2 months, things happen upside down, they can flip the coin whenever they want. So we don't have that kind of time period. So time should not be wasted.
Correct.
Yes. Second thing is, Manu, when we are doing EOIs, it's always better, especially we have seen, even I'll tell you my personal experience, because sometimes we get too emotional or sort of, we can say, too lenient with the candidates, that we start, telling them everything, and they want to do it, themselves. They want to do the EOI by themselves. They want to do the visa applications by themselves. And suddenly the client will disappear for 6 months and come back after 6 months that I've got a visa refusal. So internally we feel it very bad, because there is no sort of, that there is a one sort of bread that everybody will eat. Every case is different. It has to be understood differently. And accordingly, we advise the candidate. Overall structure when it comes to PR is, we have seen people, they will follow the website. No doubt website is pretty good, but its information and the criteria, it always advises you to visit a Mara agent. Okay.
Correct.
There is a reason behind that. We do not want, if a candidate gets invite and then further, for some reason his EOI is wrongly lodged, or his state nomination is, done incorrectly or something, or maybe even his visa, then basically, the profile for the client starts getting very sort of dodgy, and immigration understand like what this candidate is doing. They are not sure. Okay. So it's very hard for us to recover that particular client back into, a genuine or a correct situation. So we should always make sure that whenever we are doing any kind of sort of matters in regards to a visa, a professional advice, should be taken. In regards to filling up the forms, giving information, we have seen a lot of candidates, they do not like to share things with us. It's totally fine. That's your thing. But if you do not have a trust with the agent, it's better not take advice from him or her. Just change the agent, because agent, me, myself, if I'm representing someone, I want someone to be very straight and, to the point with me, so that if I believe there are some kind of things which needs to be changed, or I can help them with, it's sort of advisable to them that they should go accordingly. Then on the second hand, when it comes to in regards to selecting courses, we have seen maybe million times candidates will tell us, oh, my agent helped me get this course. My agent helped me get that course. It doesn't work like that. Okay. Agents are not there to help you, to sort of direct you. It's your responsibility as well to see, okay, I'm going into this course. Are there any benefits of this course?
True.
If it is career prospectus, yes, we are talking about, career as well. But if I'm talking about PR prospect, is there any benefit of this course? So you talk to the person. Even like, for example, you are talking to educational counselor, Rajendra himself. Just talk to him that, okay, I have heard about this course. Is there a PR in this course? Always we have suggested, candidates to make sure to be very straight with what your questions are. Be very open what your situation is in Australia, so that we can advise you accordingly.
Correct. No, I completely agree that it's been a normal practice that people, just because of saving some bucks, they think of lodging everything by their own. And at the end of the day, the case gets, destructed completely, and then they refer to a Mara agent. So
Yes.
by the time it's too late.
Yeah, then they want some kind of miracle.
Yeah,
So,
and they expect some sort of a miracle from a Mara agent, which
Yeah.
sometimes sometimes it's possible, but not most of the times. So the straight message here from Kamal sir is do not play around with immigration. Immigration understands everything. If they have given you visa, they know about your life. So do not play around. Just simple and straightforwardly go to Amara agent, who is an expert into various visa, and he understands what the immigration is looking for. If your profile suits the immigration department, of course, nobody can stop your PR. Am I correct, Kamal sir?
Yes, again, there is no such thing as a guarantee, Manu.
Yeah, exactly.
Okay, as long as we have met the eligibility, we have lodged the file, there are chances, that we might be hearing good news.
Correct. What is your last piece of advice, Rajinder? And it also includes the mistakes a person has to avoid while taking admission in nursing. And do also, I mean, this is a very common question actually, do student visas also get refused on nursing?
Again, it's depend on the profile. So whatever case officer thinking, like he's a genuine student, definitely they will grant their visa. So again, you need to mention every accurate details in your GT, so case officer can go through and get right information. So then they can you can convince, or they can understand like it's actually they have a genuine intention for this course and want to study. Again, the mistakes, if we talk, first of all, this if we just talk about diploma, apart from diploma, masters and bachelors, very expensive course, roughly around, if we talk about masters and bachelor, they have a same like around $80,000 for whole course duration. So again, bachelor, I believe around 56 weeks, and the master 104 weeks. Again, it's just a minimum, like some university do that course on that kind of like a fee structure. So again, once they're going to choose their course, for example, bachelor, so it's the same course in a different university, like a cheaper than other university. That doesn't matter, like they won't get their skill assessment or anything. In bachelor, most of the university accredit with the authority who provide their skill assessment. But again, in a master, there is a few options. Again, the master, if you want to enroll in a Monash and Melbourne, then you can get your skill assessment as a RN. Apart from, if you just enroll in other university, it will be a waste of time and money. End of the day, you can, because it's look like it's the same course, like Masters of Nursing. But again, you need to check their website, it's accredited or not, especially in a master's. But again, in a bachelor, you should choose the course, I believe, like the reasonable price on the university, because you save few money, like $1,000 with that course. So again, choose wisely, and again, choose the location as well, so you can get any future benefit with your TR or something like that. So I believe if you just going through these all information, they will be get some kind of relief and help with the financially and time and mentally.
Nana, Manu, I want to ask Rajinder. Now we are basically, doing these online sessions, every Sunday, discussing different situations. What is your role as an educational counselor? What are your responsibilities? What are you sort of in regards to being beneficial? That why should I choose you when I'm sort of getting enrolled into any sort of courses?
All right. Thanks, Kamaljeet, for asking this kind of question. Again, if we talk about, I used to work as a student counselor, like around 2 years. Then I jumped to the education counselor. So I have a idea, like if we enrolling in a fresh course, I can tell them like from scratch of admission until their visa application lodge, student visa application lodge. So I can provide them any information regarding their admission and student visa. So I can do for their financial check. I can provide them like college, which one, some student has not that financially strong, so they can choose. If we just talk about university or colleges, we can go them go with those university which one waiver from financial and again English onshore. I'm talking about onshore, but again, if you go with the offshore client, you have to must show like all the requirement, even that not required by the university. And other thing, we have a branches in India as well. So if you have a brother and sister, they have any kind of information regarding Canada, UK, USA, or Australia from offshore, we can help you with those kind of cases as well. Again, I will represent all our communities. If you have any kind of help, like you are unable to get, we can try our best. So we can provide you information according to your circumstance or other any kind of help due to pandemic. So we can welcome you. Yeah.
Perfect, perfect. I have a last question from Nidhi. In order to get admission in Bachelor's of Nursing, do I need to complete the Diploma of Nursing? I am an Australian citizen.
Manu, I need to talk to Nidhi that if she can type us, what is her background? Because if her background is not into nursing, there are less chances that they will straight enroll you into Bachelor's of Nursing.
Okay.
We have seen people, we are talking about my real brother himself, that his background was in engineering. We sort of went a Australian citizen he wants to study a Bachelor's of Nursing, and they advised, because your background is in engineering, doesn't make any sense that you should be enrolling straight into Bachelor's. So they advised accordingly him to study Diploma of Nursing first for 2 years, and then for the 2 years Bachelor's of Nursing. So in Nidhi's case, if her background is not into nursing, there are chances that the universities itself will advise you accordingly to move into a Diploma of Nursing.
Correct.
First
correct.
and then Bachelor's.
I hope that answers your question, Nidhi. But guys, for any other PR related inquiry or nursing occupation, are you looking forward to a permanent residency pathways in Australia? Are you an enrolled nurse or registered nurse or studying nursing in Australia? If you're looking for any kind of advice in your permanent residency pathway, please get in touch with Mr. Kamaljeet Singh, who sits in Ausis Group Clayton branch. If you are if you want to pursue nursing ahead, and if you want to get your admission done, student visa done, or any other inquiry like that, please get in touch with Mr. Rajinder Singh.
Okay, Manu, before we move, I think Nidhi has answered us something.
Okay.
He has said, I have done bachelor's in biotech. So yeah, Nidhi, it seems like you do have sort of biological background. I will probably advise you, if possible, you can send your academic transcript to the qualified counselor. I think Rajinder can follow on this. And then Manu, I think if she is already your student, I think Manu, yes.
Yes.
If she's already obtained 7 each, then further we can proceed further with in regards to getting the admission for her. Absolutely. But again, yeah, it seems like she has done bio sort of studies, but 7 each requirement academic transcript needs to be studied, and then we'll advise her.
Perfect. Perfect. Nidhi, so I would urge you to get in touch with Rajinder Singh. You can just WhatsApp me. I'll share Rajinder's details with you. And guys, for any other kind of inquiries, feel free to get in touch with me regarding any PTE, NAT, CCL coaching or IELTS coaching. We have experienced, for delivering the results for entire year. I have personally trained over 600 students last year and delivered immense numerous 8 ECHs and 7 ECHs in the past. Same goes to Rajinder. Rajinder has an experience. He is a certified educational counselor in Australia. He has helped thousands of students to get admissions in the right courses at the right time. And Kamaljeet sir sits at Ausis Group. He's a registered MARA agent, and he has helped thousands of people to get their permanent residency in Australia. Thank you so much, everyone, for joining.
Manu, before we finish, I just want to discuss one thing. Recently, our Prime Minister or all the government just mentioning regarding the international border will be open soon. So we can discuss like a little bit about that. So as much like in the news, they said like if all Australian who or citizen or non-citizen in living in Australia, if they get their fully vaccinated dose with the COVID vaccine. So it will be like I hope it's a good news if international border open for international student who stuck in overseas, or again, it's for good for all Australian or non-Australian citizen in Australia. They have a relief, like they can stuck for like, I think in Victoria last 1.5 years. So hopefully all viewers who watching this Facebook live, it will be a good news. Hopefully end of this year or starting of next year, all the border, Australian border opening for all the community or for all over the world.
Yes.
So hopefully, finger crossed. And again, it will be pleasure to live with you, Manu, and Mr. Kamaljeet Singh.
Thank you, gentlemen. Thank you so much.
Thanks,
And thank you, Rajinder, for finishing this live session on a positive note and a good news, of course, that international borders are going to open very soon. Maybe we are expecting them to open maybe in the month of December or January. Am I correct? Yes.
Yeah.
Yeah. So, all right. So I think this is the right time. You should, if you're trying to migrate to Australia, this is the right time to start preparing for it, because it might take some time, about 3-4 months, to actually start the migration process overall. Thank you so much, guys. Thank you, gentlemen. I'll see you next week. We are going to pick up another important session, and we're going to sit as a panel on it. Thank you so much, gentlemen.
Thanks, Manu.
Thanks.
Thanks, Kamaljeet.
Thank you very much.